Have you ever heard someone mention the pelvic floor and wonder what it actually is? Today, I'm going to break down exactly what the pelvic floor is in women. This includes what the pelvic floor does, why your pelvic floor matters, and how it can affect everything from your bladder control to your sexual function. Hi, my name is Jessica Babich, and I'm a doctor of physical therapy practicing in New York City. So many of my patients have questions about the pelvic floor and how it functions, so you are not alone, and there is a lot to learn about it. The pelvic floor is a group of muscles and connective tissue located at the very bottom of the pelvis. If you imagine the pelvis as a bowl, the pelvic floor is the supportive muscular hammock at the very bottom. In women, this hammock supports three major organs: the bladder, the uterus, and your rectum. These muscles tighten, relax, and coordinate throughout the day without even having to think about them. Your pelvic floor muscles help you control when you pee and when you poop. They support your core and your spine. They also stabilize your hips. And your pelvic floor is active during sexual activity, pregnancy, childbirth, and postpartum recovery. When these muscles are functioning well, you feel supported and strong. But when they become too weak, too tight, or even uncoordinated, you can start to notice symptoms you may not realize are connected. Symptoms like leaking, pressure, pain with sex, or constipation. Understanding what the pelvic floor is the first step in improving it. Now let's talk about the conditions pelvic floor physical therapy treats, specifically in women, and how strengthening or relaxing these muscles can change your life. It's not talked about often, but many women benefit from pelvic floor physical therapy, and many find out about it much later than they should have to, meaning they struggle for months or even years before they realize that pelvic floor PT can help their issues. This includes bladder issues, pelvic organ prolapse, pelvic pain, constipation, as well as changes associated with pregnancy, birth, and postpartum. Let's start with the bladder. Pelvic floor PT treats a wide range of bladder issues. This includes urinary urgency, urinary frequency, stress incontinence, leaking when you cough, sneeze, or exercise, and urge incontinence, where you leak when the urge hits. It also helps with nighttime bathroom trips. Pelvic floor PT is also one of the main treatments for pelvic organ prolapse, which can cause pelvic pressure, heaviness, or a bulging feeling. PT improves muscle support and alignment, helping women feel more stable and comfortable. Pelvic pain is another major category. Pelvic floor PT helps women with pain during sex, vaginismus, vulvodynia, chronic pelvic pain, and tailbone pain. Many of these conditions are caused by tight or overactive pelvic floor muscles, and learning how to release and retrain them can be life-changing. Pelvic PT also treats bowel issues like constipation, difficulty fully emptying, fecal leakage, and pain with bowel movements, and pregnancy and postpartum. Pelvic PT helps with preparing for birth, leaking, pelvic girdle pain, diastasis recti, C-section recovery, perennial scars, and rebuilding strength safely after childbirth. If you've been dealing with any of these symptoms, pelvic floor PT may be exactly what you need. It's evidence-based, it's gentle, and it's incredibly effective. What questions do you have about pelvic floor physical therapy? Drop them in the comments below and I will answer them in future videos. If this video helped you feel informed, confident, or more hopeful, hit like and subscribe, and share this with someone who you think would benefit. And if you live in New York and would like personalized guidance, you can work with me either in person or virtually. I'm Dr. Jessica, and I'll see you in the next video.